My name is Sarah Blau, and I am presenting on why the U.S. should end the war on drugs. Just a little introduction. The war on drugs was officially declared by President Nixon in 1971, and it was a pivotal moment in American history. It was the beginning of an aggressive approach to address drug-related issues. We'll talk about the negative effects of this war and the benefits of legalization of drugs. And we'll talk about some other case studies of other countries and how how the legalization of drugs in those countries has impacted their societies and their criminal justice systems. So the main point we're arguing is that the United States should end the war on drugs for a more effective and compassionate approach to drug-related issues. A little bit of a historical context. War on drugs was declared by President Nixon in 1971. We talked about this a little bit. The social and cultural climate at the time was pretty thick. So it was right after the civil rights movement, and there was a lot of public anxiety surrounding drug use. The political climate, like I said, was very thick. So Nixon's declaration came at a time where it fit the narrative that that society was believing and feeding into. Nixon declared drug abuse as public enemy number one, and that was the beginning of a multifaceted and aggressive approach to addressing drug-related issues. A couple key policies and legislation. The Comprehensive Drug Abuse Prevention and Control Act of 1970 pretty much was enacted as a response to increasing concern over drug abuse. And part of this was the DEA, which is the Drug Enforcement Administration. And they were established in 1973 to coordinate and enforce drug-related laws at the federal level. There were also mandatory minimum sentences from 1986 and 1988. The Anti-Drug Abuse Acts were enacted, which introduced mandatory minimum sentences for drug offenses. This was important because it marked a shift towards punitive measures. They wanted to deter drug-related activities through harsh legal consequences. So, and this doesn't exactly line up with the early goals and intentions of the war on drugs. So the early goals and intentions were prevention and treatment. So trying to prevent people from even starting to investigate or look around and test drugs, and also to treat people that had been addicted and trying to rehabilitate those who wanted to become sober, right? And we are seeing legislation and these intentions kind of clash. Other goals included disruption of supply chains and changing public perception. This public perception, the narrative they wanted to push was that drugs were a significant threat to society, and they wanted to push for a unified national effort to combat drug-related issues, fostering a sense of collective responsibility. The financial cost of the war on drugs. Budget expansion is a key player here. So there have been substantial financial resources allocated to law enforcement agencies for drug-related enforcement activities. And over the years, this budget just keeps expanding. Law enforcement personnel is part of this. So law enforcement agencies have to recruit and train law enforcement personnel dedicated specifically to drug control. And the allocation of these funds not only involves equipment and technology, but also human resources necessary for surveillance, interdiction, and apprehension. So we kind of talked about equipment and technology obviously is going to be expensive, and there's ongoing operational costs beyond just the initial fixed costs, the initial investments. Operational costs are just maintaining and deploying law enforcement resources, and this contributes to the overall financial burden. This is like fuel, maintenance, and other logistical expenses associated with day-to-day activities of drug enforcement. Failure of deterrence, this is important. So regardless of the fact that we have this war on drugs, that we've declared that drugs are public enemy number one, drug use is rising. Rates of drug use are rising. So, and this has an impact on a lot of vulnerable communities. Studies show that punitive measures disproportionately affect marginalized communities, and we're going to talk about this a little bit later. But we see that there's a disproportionate amount of sentences and arrests at marginalized communities versus non-marginalized communities, majorities. Another comparison that's important to make is there are lots of other countries that have aimed to legalize drugs and have started, and we see that actually drug-related harms are happening at a lower rate, but drug use is not spiking. So we're seeing that the legalization of drugs is actually reducing the amount of harm caused to society, and drug use is not increasing. So that's super important to remember. Next, we're going to talk about this, like I said, the impact of minority communities, of the war on drugs on minority communities, sorry. I'll just talk about an example that we found. There's disparities in prescribed opioids, and some doctors feel that black patients are physically stronger than white patients, and that's why 29% of black patients are less likely to be prescribed opioids, which is ridiculous that doctors think that black people are more tough than white people, so they don't deserve to take the same medication that white people are taking. I don't understand how that can be seen as okay. Other media outlets have reported that black people do not use drugs any more than their white counterparts, but suffer more frequent, longer, and harsher prison sentences for doing so. So black people or marginalized communities are being arrested and facing higher and harsher prison sentences for the same crimes that non-marginalized communities are facing. And this is wrong, and it's something that the war on drugs is facilitating and incentivizing. We're going to kind of switch gears here and talk about legalization and decriminalization, because there's some key differences. Legalization is the complete removal of legal prohibitions and allows legal production, distribution, and consumption of the substance. Uruguay legalized drugs in 2013. It has lots of social and economic impacts that we'll talk about later, and it offers economic growth, but it also raised concerns about surrounding potential misuse and the dangers of that. And decriminalization eliminates the criminal penalties for possession or use, but doesn't necessarily legalize drugs. It rather focuses on treating drug use as a public health issue. Portugal decriminalized drugs, we're going to talk a lot about this, and has seen a lot of extraordinary impacts. They had a significant decrease in drug-related deaths, went from 369 to 152 in a single year, and a drastic decrease in the spread of HIV and AIDS among injecting drug users. It reduces incarceration rates, deaths, and diseases. It can be kind of tricky to regulate, so we'll talk about that. There are lots of economic opportunities that come from legalizing and decriminalizing drugs. So it can create a legal market where businesses emerge, jobs are created, and revenue increases. So we've seen a 33% increase post-decriminalization in the U.S. in 1 year. So after certain markets decriminalize drugs, or certain states decriminalize drugs, we see job opportunities arise and employment increases. Ending the war on drugs would also boost government revenue, because you can tax drugs pretty heavily due to the multi-step process of producing, packaging, and selling substances, so they can get taxed 3-4 times in the distribution chain. And that brings in a lot of government revenue, which stimulates and betters the aggregate economy. Another thing that I think ending the war on drugs would help is a public health approach. So this is aimed to address the broad individual, environmental, and societal factors that influence substance misuse and its consequences to improve the health, safety, and well-being of the entire population. So pretty much here we're saying that we should be focused on the health of individuals and not punishing those who are already in a hard downward spiral, if that makes sense. We're trying to rehabilitate individuals and improve the health of society, instead of just grab these people that have been struggling with drug abuse and throw them in prisons where they get involved in gang activity, and we've seen that prison violence increases among drug users. and we'll talk about that a little bit later as well. Ending the war on drugs would promote prevention. There are many treatment services that have been enacted in other countries that we're going to talk about, but healthcare systems can help prevent prescription drug misuse by holding staff accountable for prescribing controlled substances, and then you can train your staff on different ways of managing pain and anxiety, and you can promote effective integration and prevention and treatment services. So ending the war on drugs allows healthcare systems to do what they were supposed to do and promote the health of individuals. So instead of punishing those and sending them, just carting them up and sending them to prison, it allows healthcare professionals to provide and help those who are struggling with something that's really hard. So there's some implementations for policy and practice of ending the war on drugs that we're going to talk about. So expanding access to effective evidence-based treatments for those with addiction and also less severe substance use disorders is critical, but broader prevention programs and policies are also essential to reduce substance misuse and the pervasive health and social problems caused by it. So pretty much what we're saying here is we want to not only help those who have already fallen down that hole and who are already struggling with drug use, we also want to prevent drug use. Many policies at the federal, state, local, and tribal levels aim to reduce the harms associated with substance use and have proven very effective in preventing and reducing alcohol misuse and its consequences. More than 300,000 deaths have been avoided over the past decade simply from the implementation and enforcement of effective policies to reduce underage drinking and DUI. So pretty much expanding to prevention programs and helping those who have not gone down that path yet to stay and to distance themselves from drugs and alcohol is going to save the lives of many in our society. More implementation. To be effective, prevention programs and policies should be designed to address the common risk and protective factors that influence the most common health threats affecting young people. They should be tested through research and should be delivered continuously throughout the entire at-risk period by those who have been properly trained and supervised to use them. So people that are enacting these prevention programs should be trained, and everything they do should be evidence-based, which will take time, and this is why decriminalization of drugs is hard to regulate, but that's because we're trying to be so careful about what we're doing, because we know that we're dealing with lives of American individuals, and we're trying to help people instead of enforce punitive policies. Treatment and rehabilitation. So ending the war on drugs in the United States is essentially shifting the main focus of treating drug problems from punishment to treatment, which is kind of the overarching theme of this whole presentation. Is we should be caring about people instead of punishment. It means viewing drug addiction as a public health issue instead of emphasizing criminalization and punishment. Rehabilitation is crucial to ending addiction, and by decriminalizing drugs, the criminal justice system of the United States is breaking the major barriers to accessing rehabilitation. It decreases costs, societal stigma, and geographical barriers surrounding drug use and rehabilitation. So there's been a couple of projects, we'll talk about a few more later, but Project ASSERT, which is Alcohol and Substance Abuse Services Education and Referral to Treatment, was founded in Boston, Massachusetts, and it's a hospital-based government-funded program. And it connects individuals to individualized rehabilitation programs and decreased drug relapses among many who are involved in this program. So you go to the hospital with your drug abuse issue, and they will match you to an individualized rehabilitation program that will work, that is supposed to help you individually, and it is very effective in decreasing drug relapses and helping people who are addicted overcome that. There are many successful treatment methods. These are some that Project ASSERT would reference you to, but not all. Cognitive behavioral therapy, motivational interviewing, group therapy, individual therapy, dialectical behavioral therapy, 12-step programs, and guided family therapy. And while we're talking about prevention and treatment, we want to talk about the money that sobriety saves you. So we've been talking this whole presentation about individualized help and care. So we want to talk not only about the government revenue increasing and vague economic benefits, but also how much money you can save by staying sober. So around $2,400 to $3,600 a year you can save by staying sober or by becoming sober. So by preventing or treating those who have been tempted with drug abuse issues, you can save thousands and thousands of dollars. And this is for alcohol. There are other drugs that are much more expensive, and you can use these savings to pay off debts, save for retirements, and invest in healthier lifestyle. So we just thought this would be interesting to talk about, because we've been talking about individualism throughout the whole presentation. We wanted to talk about the individual benefits for those for ending the war on drugs, for people that have already fallen down that drug abuse path. There are many harm reduction strategies. So these are some of them. The needle exchange programs. So what this does is, instead of punishing those who have already, injected themselves with needles, who've shot heroin and other drugs, it actually provides clean needles to reduce the risk of bloodborne infections among injecting drug users. So not only is it focused on helping the individual that's struggling with drug abuse, but also it's focused on keeping others around them safe as well. Supervised injection sites is kind of along the same lines. So these offer safe and supervised environments for individuals to use drugs under the supervision of healthcare professionals. And it also provides education and outreach. This is more on that prevention side. So it provides information on safe drug use practices, potential risks, and harm reduction resources. So some harm reduction policies in other countries include HAT, which was enacted in Switzerland. This is heroin-assisted treatment, and pretty much it provides pharmaceutical-grade heroin to individuals with severe opioid use disorders, and this stabilized users' lives, reduced criminal activity, and improved overall health. There's also take-home naloxone programs in Australia. This is an opioid overdose reversal medication, and it's helped a lot of individuals that were at risk of overdosing on opioids to reduce that, and they've seen actually a decrease in deaths due to opioid overdoses since this take-home naloxone program was enacted. Another thing that the ending the war on drugs would do that would benefit society is changing public attitudes towards drug policies. So the point of the war on drugs in 1970 was to view drugs and drug-related issues as public enemies instead of viewing it as a public health issue, which is really what it is. Public attitudes have a large influence on drug policy. Shifts in public policy have historically bred changes in legislature, and some of the examples of these public awareness campaigns are here. There's Drugs, It's Time to Talk, which is enacted in the United Kingdom, and pretty much it emphasizes community engagement and encourages open conversations about drug use, and it acknowledges realities of drug use while promoting harm reduction strategies and emphasizing the importance of seeking help. Another one is Dose of Reality, which it was enacted in New Zealand, and it takes a user-focused approach and it provides honest information and education about risks and harms associated with drug use. So now we want to go into a little bit of a comparison to drug policies in other countries. Portugal's decriminalization model, we talked about this earlier, they decriminalized drugs, and it severely benefited their country. So number of drug deaths has decreased in more than half in a single year, and there's a significant decrease in the number of HIV and AIDS cases. They achieved these two mass improvements by shifting to a health-centered approach instead of a punitive approach. Switzerland's heroin-assisted treatment, we talked about this earlier. It helps those who are at risk for overdosing on opioids, and it actually decreases death by opioid overdose. Addressing systemic inequalities in drug enforcement. There have been historical disparities, so legacy of racial disparities. It's important that we address systemic inequalities in drug enforcement, and we see that minority communities are at a much higher risk of over-policing, harsher sentences, and increased incarceration rates. And these disparities lead to a need for some action to be taken both legally, fiscally, and in communities to combat the systemic inequalities in drug enforcement. Combating systemic inequalities in drug enforcement, these are some policies that are going to help. Breaking down barriers. There's education and employment opportunities through legalization of drugs, and we've talked about this. This breaks down barriers to education and employment. There are reentry programs, so this is helping those who are recovering or who have recovered from drug abuse issues re-enter the job market and re-enter society as beneficial and helpful members of society and communities. And community investments. It's important that we invest in marginalized communities. We need to improve healthcare, housing, education, and economic development, and address the root cause of drug-related issues, which are the things that I just mentioned: healthcare, housing, education, and economic development. So in conclusion, yes, the U.S. should end the war on drugs for many, many reasons that we've talked about. It will benefit the individuals who are affected by drug abuse by helping them to re-enter society and be productive members of society. It aims to treat and rehabilitate those who have fallen victim to drug abuse issues, and it's aimed to educate all members of society and prevent drug use, and also to facilitate an environment where you can use drugs in a safe way. Legalizing and regulating certain drugs creates a legal market where businesses emerge, jobs are created, revenue increases, and overall aggregate economic benefits are seen. So these effective policies have proven to be effective in preventing deaths from underage drinking, and they've also prevented deaths in other countries that have enacted these policies. So by ending the war on drugs, the United States is essentially shifting the main focus of treating drug problems from punishment to treatment, from criminalization to individualization. Rehabilitation is crucial to ending addiction. It decreases cost, societal stigma, geographical barriers surrounding drug use, and rehabilitation. The United States should end the war on drugs for a more effective and compassionate approach to drug-related issues. Thank you.